We appreciate the role that Parliament is playing in this regard. I therefore want to take this opportunity to ask members of the public to submit their views to the committee to enable us to come up with a solid law that is going to exist in perpetuity. I also want to pick out the importance of leveraging modern ICT. We must use ICT to maximize our efficiency within the activities that we want to undertake. If we do so, and if we predicate what we are going to do on good management, good governance, provision of ICT, then we should be able to cast the net wider on donors to net the 70% of our target population at the ages of between 18 and 65 in a very short time. We should create a clean register of donors with which to enable us to know who our regular supporters are. We should incentivize our blood donors through modern forms of recognition and appreciation, including, and I have proposed this before, branding, levelizing, so that people know what level of blood donor they belong to. We should be able, again, leveraging on ICT, to track blood from point of donation to the point of utilization. We should be able to monitor our blood supply levels, complete with the requisite alerts to deficiency and all oversupply. We should be able to manage supplies in relation to needs, including the need to distribute blood between hospitals and counties. The responsibility, therefore, Mr. Chairman, is on you now to define the systems that will catapult blood transfusion services in Kenya to be responsive to modern needs and demands. I therefore take this opportunity to congratulate you, congratulate the team, congratulate those of you who have been given this opportunity, and wish you the best of luck in this undertaking. You have our support. I believe you have the support of all Kenyans, and particularly you have the full support of His Excellency the President, and he was quite happy and glad to hear about this team, and hopefully we will be able to address our concerns in the fastest possible time. Let me just add the following, that moving forward as a ministry and in terms of management of blood, we do not want to see duplication of activities. We are going to centralize all blood activities into one. And there will be no other activities taking place outside the ambit of this institutional framework. And anything that is currently going on will be brought to this framework so that we know the right hand must know what the left hand is doing. Anything involving the storage, anything involving the search for, anything involving the management of, must now be brought squarely into the ambit of the institutional framework that we have built. Before I ask the peers to make remarks and give a vote of thanks, I also want to, for purposes of this meeting, to say that these reforms that we are making, and particularly the issue of blood, as I said earlier, is part of the wider agenda. And as we begin, as we are so involved in the issue of the management of COVID-19, I think it is important for us to remember that the rest of the disease system in the country continues. You know, there is a tendency to think that we are now, this ministry is a ministry of COVID-19. It is not the ministry of COVID. You know, even I hear children are calling me waziri wa corona. Now, let me make it clear that the ministry's normal activities remain and must continue. And this is the reason why we decided that we must continue with this effort. We must continue with other efforts. We must continue with everything to finish and conclude universal health care. We must continue reforms in all other our institutions, so that we can be able to achieve what our ultimate goal is. And as I said from the beginning, our goal is a pleasant engagement between a service provider and a patient. That is what we are trying to create. The long and short of it is that a patient sits here, a provider sits here, and they are both happy. You know, the patient is happy because they have been given everything that they can. The provider is happy because they have been supported to do so. And that's the long and short of it. And as we fight coronavirus, because it is here with us and there is nothing much that we can do to change, I call on each person, I call on all of us, because even patients, all the patients, all sorts of patients, require your services. And therefore, I call on you and inform you at this point that we now in this country have some 363 positive cases in Kenya, having today confirmed some 8 new cases. And these 8 new cases come equally from Nairobi and Mombasa, because we have got 4 from Mombasa, and you can see now Mombasa is becoming a concern, an area of concern. And we have got the rest of them from Nairobi, and all of them are Kenyans. All of them are Kenyans. Before it used to be people have traveled elsewhere, but these ones are all Kenyans. But we are also happy because through the work of the very diligent health workers, we have now also discharged some 8 people today, bringing the total of those who have recovered to 114, just about a third of the ones that that had become positive. But I also want to take this opportunity also to add that we are also, in addition to everything else that we are doing, trying to play our role as a ministry to see what we can do, what measures we can take, how we can assist the economy to continue going on in spite of everything. We are learning from experiences elsewhere. Countries are opening up much earlier than we think we should. Other countries have delayed, but we want to make our own measures based on our own experiences and based on what we have seen as a people. Yes, as you know, when the president made his remarks, he talked about the reopening of restaurants within certain protocols. And just to share with you some of the things that we will expect that these protocols will involve is that restaurants will operate between 5 and 4 p.m., not later than that, because after that, then it becomes difficult to for the people to get home, just for curfew. But at least within that period, a lot of people were not able to go for lunch. Places near them can be able to do so. There are people who work in those restaurants. They can be able to do so. But of course, for them to do that, we also have asked that those restaurants that are going to open for this purpose must limit the number of persons who are going to be in the restaurant, so that they can be able to keep the social distances that we have recommended. They can be able to keep at least 4 people for 10 square meters. The tables within the dining areas must be spaced at least 1.5 meters apart from each other, and customer sitting must also maintain the social distancing that is required. We must maintain the social distances not just along, but also behind, behind each other. We have also said that this is not a license to start opening pubs. It is not a license to start opening alcohol sale across the country. Alcohol shall only be sold with those having meals in the normal manner in a restaurant. We have not opened bars. Then we have said that when we are in those restaurants, we will not be serving buffet lunches or self-service lunches for obvious reasons. I think anybody will understand that if you are going to go to those restaurants, then there will be no buffet, as we understand it, or self-serving food and people walking around and, in the food areas. That cannot happen. Then in terms of the safety within the restaurants, what we expect to see is that, number one, that anybody walking into a restaurant must wash their hands first. They must sanitize themselves. They must have a mask. And more seriously, is that restaurants that are going to open with people who have been tested, who are going to be COVID-free. So if your persons have not been tested, you cannot open a restaurant, because it is very possible then for a person serving there to spread the disease amongst all customers who walk in. And this is from experience. I think some of you know what happened in some of the areas we had quarantine facilities, and some of the people passing the disease, even in those facilities, could very well be those serving the people. So all other measures, running water and what have you, all those measures will be taken to ensure that people are safe in the restaurants. We have also, from an economic, again to support the economic perspective, the President announced the issue of hygiene workers to clean up all the slum areas, all the populated areas, and this has two purposes. One of them is that we are going to keep people working, particularly young people, the youth in those densely populated areas. But even as they work, again, there's a protocol, there's a health protocol. Officers to be part of those teams, to go with thermoguns and ensure that there is nobody walking with a high temperature. Even as they clear the garbage areas, to keep distances when they do so. And all other protocols that have been issued by the ministry. This is all in an attempt to make sure that people keep eating, and people can feed their families, even as this situation escalates. Of course, we will, as the President said, escalate or de-escalate these measures depending on how we see the situation going. By the end of the day, as I have repeated many times, the Kenyan situation will unravel itself because of one single factor, and that is our own self-discipline. If we discipline ourselves, and if we take responsibility at an individual level, then it is quite possible that we can begin to defeat this virus. But if we don't do so, then we will continue to have challenges. And these challenges are going to be very expensive in terms of lives and in terms of the economy. But my hope and prayer is that this is what is going to happen. And I'm glad to say that we have noticed that people have actually begun to adhere to the rules that we are making. And particularly on the hygiene side, what that has done, it has brought down already the cost of healthcare, because cases of diarrhea, cases of stomach problems have gone down dramatically. And we have no doubt that this is because of the hygiene measures that we have taken. So without adding anything more, let me just first invite the PS to